Chakraborty, a risk and behavioral expert. Good morning to you. The testing capacity in the U.S. not at the same level some experts believe it should be. So they're looking to Iceland for some insight. Iceland has reportedly tested about 10% of its population, more than any other nation. And one of the key findings, about 50% of those who test positive for the virus are asymptomatic. Are you surprised by that?
I'm not surprised by that. It makes sense as we think about how this virus has a range of symptoms from mild to severe. And so you would expect some percentage of that to be asymptomatic. Remember, 10% of the population of Iceland, we're talking about a population of 360,000 people, right? That's similar to Tulsa, Oklahoma in the United States. The United States is roughly 1,000 times more people than Iceland. And we've tested about 0.6% of the US population. So we are going to find as we continue to test, and we have in absolute terms had the most amount of tests because our numbers are just so much bigger than the countries we're comparing ourselves to. And as we begin testing, we're going to find increasingly that range of symptoms from asymptomatic to really severe. And that's going to be necessary because we can't see this virus. This is a microorganism that you can't even see through a microscope. So what testing does is it allows us to see it. We can see who's asymptomatic, who is potentially likely to fall really critically ill, which data coming out of Europe is continuing to reinforce is over the age of 60 and those with underlying conditions. And that will allow us, really importantly, to open up the economy again. Once we can see the enemy, then we can think about how we live with it and how we work around it.
And I want to pick up on that part that you were talking about, because officials in Iceland, they're not just testing sick people and their contacts, they're testing at random by selecting names out of the country's telephone directory.
What?
Yeah. They still have telephone books, but they're also using the telephone directory. Now, the U.S. is obviously a lot bigger, as you mentioned, than Iceland, but is this the type of testing that we should think about doing?
Right. So I think, the takeaway from that is, wow, there's still telephone directories. Yeah. But quite seriously, we need to test a random sample because it's from that we will get a better picture of what this virus looks like and exactly where it is clustering and the types of people and populations that it's affecting. That being said, over-testing doesn't make sense. When we go to the doctor, we are asked questions before we are given tests. And that's not going to be any different for COVID-19 going forward. But to initially get a picture of how this virus is moving through the United States population, it will be important to do random testing to be able to predict also where it could create another outbreak, especially as we think about opening up the economy again. We have lessons from Germany, from Sweden, from Denmark about how this doesn't have to be a binary narrative of primary impacts and looking at the public health impact in a silo versus the economy. It's not one or the other. We can think about how to protect public health and still get people back to work. We need to look at this bigger picture and be smart about how we now reopen people's livelihoods, because what we don't want to see is extended lockdown that ultimately results in ripple effects that are worse for the outcomes overall. And I mean from public health to society to the economy. There's a big picture here we need to consider.
And we hope that many of our leaders are considering that big picture right now and worried about that second or possible third wave. Chakraborty, thank you.
All right, here's what's trending now.